Hello, and welcome to Healthy Living. And in today's video we'll be talking about 10 common signs and symptoms of hypothyroidism. Here's a few things you should know. Thyroid disorders are common. In fact, about 12% of people will experience abnormal thyroid function at some point during their lives. Thyroid disorders are 8 times more common in women than in men. Thyroid issues can worsen with age and may have distinct effects on adults than on kids. Thyroid hormone is fundamentally in charge of regulating your body's energy, growth, and metabolism. Too much or too low levels of this hormone can cause issues. Your metabolism slows down and many body components experience less growth or repair when you have hypothyroidism, or low thyroid hormone levels. What is hypothyroidism? Here's a few things you should know. The thyroid gland is a little organ that is wrapped around the windpipe or trachea in the front of the neck. Its primary function is to produce thyroid hormone, which mostly regulates our body's metabolism. A little gland in the middle of your brain called the pituitary regulates your physiology and secretes thyroid-stimulating hormone, TSH. The thyroid gland receives the signal TSH to release thyroid hormone, one trusted source. When TSH levels rise, the thyroid gland occasionally is unable to respond by producing additional thyroid hormone. As the issue starts at the thyroid gland level, this condition is referred to as primary hypothyroidism. Other instances, TSH levels fall and the thyroid is never informed to produce more thyroid hormone. We refer to this as secondary hypothyroidism. The condition known as low thyroid or hypothyroidism can result in a number of symptoms. Here is 10 common signs and symptoms of hypothyroidism. Number 1. Feeling tired. Being exhausted is one of the most typical signs of hypothyroidism. The thyroid hormone regulates energy balance and might affect, depending on what else is happening in your body. Thyroid hormone receives signals from the brain and directs cells to adjust their roles. People with elevated thyroid hormone levels experience jitteriness and anxiety. People with poor thyroid function, however, experience fatigue and sluggishness. In one study, 138 hypothyroid people reported feeling physically worn out and engaging in less activity. They also mentioned feeling mentally exhausted and lacking motivation. Despite maybe sleeping more, those with low thyroid function feel exhausted. In another study, 42% of participants with low thyroid hormone reported sleeping more than they did previously, compared to 50% of hypothyroidism patients who felt chronically exhausted. An indication of hypothyroidism may include feeling sleepier than normal without a solid rationale. Number 2. Gain weight. Unexpected weight gain is yet another typical hypothyroidism symptom. Not only do people with low thyroid function move less, but they also send signals to their muscles, livers, and adipose tissue telling them to store calories. Low thyroid levels cause a change in metabolism's operating mode. Your basal metabolic rate, which measures how much energy you consume while at rest, drops as opposed to burning calories for development and exercise. Your body consequently has a tendency to accumulate extra calories from the diet as fat. Because of this, weight gain can result from low thyroid hormone levels even when caloric intake is unchanged. In fact, one study found that in the year after their diagnoses, patients with newly diagnosed hypothyroidism gained an average of 15 to 30 pounds, 7 to 14 kilograms. If you have been gaining weight, first think about whether other changes in your lifestyle could be the cause. Bring it up with your doctor if you feel like you're gaining weight despite following a healthy diet and exercise regimen. It could be an indicator that something else is happening. Number 3. Feeling cold. Calorie burning produces heat as a byproduct. Think about how heated you get when you exercise, for instance. You are burning calories, which is why, even while you're sitting still, you're still burning some calories. However, hypothyroidism causes your basal metabolic rate to drop, which lowers the amount of heat you produce. Thyroid hormone also raises the temperature of brown fat, a particular kind of heat-producing fat. In cold areas, brown fat is crucial for preserving body heat, but hypothyroidism stops it from doing its job. You feel colder than those around you because of low thyroid hormone levels. 40% of people with poor thyroid function experience increased sensitivity to cold. This might simply be how you were formed if you've always preferred the temperature of the space over that of the individuals you live and work with. However, if you've recently discovered that you feel cooler than usual, it could be a symptom of hypothyroidism. Number 4. Weakness and aches in muscles and joints. The metabolic switch is flipped toward catabolism, which is when the body breaks down body structures like muscle for energy, by low thyroid hormone. Muscle strength declines during catabolism, which could result in sensations of weakness. The breakdown of muscular tissue can cause pain as well. Everybody experiences weakness occasionally. However, compared to healthy persons, those with hypothyroidism are twice as likely to feel weaker than usual. In addition, 34% of people with low thyroid get muscle cramps even when they haven't recently exercised. Levothyroxine, a synthetic thyroid hormone, replaced low levels of thyroid hormone in one study of 35 people with hypothyroidism, and when compared to no treatment, enhanced muscle strength and reduced aches and pains. Another study found that individuals getting thyroid replacement therapy reported a 25% increase in their sense of physical well-being. Aches and weakness are common after exerting oneself. However, new, or particularly escalating, aches or weakness are a solid cause to see your doctor. Number 5. Hair loss. Thyroid hormone controls hair follicles similarly to most other cells. Hair follicles are particularly vulnerable to low thyroid levels than other tissues because they contain stem cells with a brief lifespan and quick turnover. Hair follicles stop rebuilding as a result of low thyroid hormone, which leads to hair loss. When the thyroid problem is treated, this usually gets better. In one study, low thyroid hormone was discovered in roughly 25 to 30% of patients who visited a specialist for hair loss. When people over 40 were included, this rose to 40%. Additionally, a different study revealed that 10% of people with low thyroid hormone levels who have hypothyroidism may experience hair thinning. If you notice sudden changes in the rate or pattern of your hair loss, especially if it starts to seem patchy or coarser, you may have hypothyroidism. Unexpected hair loss can also result from other hormonal issues. If you're unsure about whether your hair loss is cause for concern, consult your doctor. Number 6. Itchy and dry skin. Skin cells share the same rapid turnover as hair follicles. As a result, they are equally vulnerable to losing thyroid hormone-induced growth signals. Skin may take longer to recover when the usual cycle of skin renewal is disrupted. This indicates that the skin's outer layer has endured more harm over time. Additionally, it implies that shedding of dead skin can be slower, resulting in flaky, dry skin. In one study, 74% of people with poor thyroid function reported having dry skin. It's difficult to determine whether thyroid issues were the root of dry skin because 50% of individuals with normal thyroid levels also had it from other sources. The survey also revealed that 50% of hypothyroid individuals claimed that their skin had gotten worse over time. Thyroid issues can more readily be detected by changes in skin that cannot be attributed to allergies like hay fever or new goods. Finally, autoimmune diseases can occasionally lead to hypothyroidism. Myxedema, a condition where the skin becomes swollen and red, can result from this. Other causes of dry skin are less specific to thyroid issues than myxedema. Number 7. Feeling down or depressed. Depression and hypothyroidism have been connected. Although the causes are unknown, it could be a psychological sign of a general decline in health and energy. When they have hypothyroidism, 64% of women and 57% of men report having depressive symptoms. Anxiety affects roughly the same amount of both men and women. In one trial, thyroid hormone replacement therapy outperformed a placebo in treating depression in patients with moderate hypothyroidism. Another study of young women with moderate hypothyroidism revealed elevated depressive symptoms, which were likewise associated with lower sex life satisfaction. Additionally, hypothyroidism is frequently brought on by postpartum hormone imbalances, which may also be a factor in postpartum depression. An excellent reason to consult a doctor or therapist is when you're feeling down. Regardless of whether the depression is brought on by thyroid issues or something else, they might be able to help you deal. Number 8. Trouble concentrating or remembering. Many hypothyroidism sufferers lament about mental fuzziness and difficulty focusing. Each person experiences this mental haziness differently. In one study, 22% of those with low thyroid levels reported having more trouble with simple math, 36% said they thought more slowly than normal, and 39% said their memories were worse. 14 people with untreated hypothyroidism participated in a different trial, and they had trouble remembering verbal cues. Although the exact reasons are still unclear, treating low thyroid hormone helps with memory problems. Everyone occasionally experiences memory or concentration problems, but if they are abrupt or severe, they may indicate hypothyroidism. Number 9. Constipation. Your colon's movement is slowed down by low thyroid levels. One study found that compared to those with normal thyroid hormone levels, 17% of those with low thyroid hormone have constipation. In this study, 20% of participants with hypothyroidism and only 6% of those with normal thyroid function reported that their constipation was growing worse. Constipation is a typical complaint among hypothyroidism patients, however it rarely represents the only or the most serious symptom. Try these natural laxatives if you encounter constipation but otherwise feel healthy before worrying about your thyroid. Consult a doctor if they don't help. Your constipation gets worse, you go several days without passing a stool, or you start experiencing stomach pain or vomiting. Number 10. Heavy or irregular periods. Menstrual irregularities and excessive bleeding are both associated with hypothyroidism. According to one study, 26% of women with normal thyroid hormone levels and 40% of women with low thyroid hormone had increasing menstrual irregularity or excessive bleeding in the previous year. In a different study, 30% of hypothyroid women had irregular and heavy menstruation. These women underwent testing for additional symptoms, which led to the discovery of their hypothyroidism. Abnormal thyroid hormone levels can interfere with the signals sent by other hormones that regulate the menstrual cycle. The ovaries and uterus are also directly impacted by thyroid hormone. Other than hypothyroidism, a number of conditions can result in heavy or irregular periods. Before you start stressing about your thyroid, think considering consulting a gynecologist if your periods are thick or irregular and interfere with your daily activities. So the bottom line of this is that hypothyroidism, or low thyroid, is a common disorder. It can cause a variety of symptoms, such as fatigue, weight gain and feeling cold. It can also result in problems with your hair, skin, muscles, memory or mood. Importantly, none of these problems are unique to hypothyroidism. Yet if you are having several of these symptoms or they are new, worsening or severe, see your doctor to decide if you need to be tested for hypothyroidism. Fortunately, hypothyroidism is generally treatable with inexpensive medications. If your thyroid hormone levels are low, a simple treatment could greatly improve your quality of life. Thanks for watching. I hope you learned something from this, and if you like this kind of video, consider subscribe to this channel and don't forget to click the notification bell for more upcoming videos.